Let's go into primitive reflexes and what they mean. Has a big thing to do with children, childhood developmental disorders, anything behavioral disorders, big time with kiddos. These are the guys we're looking for. This is the foundational one, especially for kids that we're looking at is primitive reflexes. So this first part, we got to just talk about what primitive reflex is, what it means, all right? So when you look at primitive, that just means older. Think about animals and how they react. That's more primitive. They can't control their reactions. It's almost like if you scare them, they're either going to bite you or they're going to run away. That is a primitive reflex, not something that they have good control over. All of these reflexes, which are natural reactions, they all occur in this brainstem area right here. Okay, this brainstem area has to do with survival, right? So that's all it cares about is, hey, I need to either run away from this thing or I need to fight it and kill it, otherwise I could die. So like that's all that brainstem area cares about, and that's where these primitive reflexes originate. And they should be with every young kiddo as an infant, and that's what helps them develop how to move and develop all their movement patterns and how to move their head, how to move their arms and their legs, and all these things all originate in this brainstem area. These primitive reflexes, or these older reactions that we can't control, this is what a reflex is. It's kind of like when I hit your kneecap and you kick your foot. That's a reflex too. Another name for it is frontal release signs. All right, people with strokes, some of these primitive reflexes come back because they've had a stroke to an area of their cortex, or this area of the brain up here that we can actually control. It's like thinking, our ability to control movement, our ability to feel sensations. That is this cortex area up here. So whenever they say their frontal release signs, what they're talking about is this area right here. This area right here, whenever it gets hurt or damaged or isn't developed enough, as in used enough as a kiddo with these primitive reflexes, then these start showing back up. So this area right here goes down and helps one to be able to control those primitive reflexes, so you're not always being reactive, or you're not always being angry, or you're not always having to bite someone's head off or run away from them. So it helps the person be able to control their emotions and control their movements, pretty much control their reflexes that are instilled in us in order to be able to survive. So once again, brainstem, that's more survival stuff. Now when we get up here, now that's our ability to think, to control, to rationalize, right? And the healthier this area is, the more it can shut down this area, so someone's not always either in fight or flight response. Another thing to note about these reflexes, I think it's important for teachers, practitioners, also caretakers and parents to understand that a lot of these things that kids are doing, they're not doing it on purpose. It is literally a reflex. So if you can understand that fact, that's going to help you better be able to rationalize and understand what they're doing, and take a little bit of less stress off of you and help with the understanding of it all. What we're going to dive into next is all the different types of primitive reflexes, how we test them, what kind of common symptoms kids have, and then obviously what we do to treat it here at the office that seems to work the best to, one, fix the primitive reflex, and two, make their frontal cortex, that area of the brain, work better. Because whenever we're looking at this area of the brain, once this area of the brain works good, then we can move complexly with multiple body parts and do complex things. And then after that comes the ability to think complexly, rationalize, the ability to do problem solving, mathematics, and all that other fun stuff. So stay tuned. One of the primitive reflexes we're going to get into today is called the Asymmetric Tonic Neck Reflex, or like we call it, the ATNR. Research has shown that this primitive reflex with kiddos typically gets initiated and started whenever they're going through the birthing canal, having to twist and move to get through that. That's what they think, that's what they're trying to suggest. That's a theory. We don't really know why. What we do know is whenever you have an infant and they're like in their infant stages, this reflex is really, really important whenever you put them on their stomach, or they roll over onto their stomach when they're sleeping, that whenever they turn their head, or whenever they are on their stomach and one of their arms is outstretched, that they turn their head so that they're not laying flat on their face, and that's like what they predict is one of the major causes of SIDS, sudden infant death syndrome, which is they didn't develop this reflex so that whenever they're laying on their stomach and one of their arms is outstretched, because when you lay on your stomach, one of them is going to be outstretched, that they don't turn their head reflexively. That is a reflex that should be there with kiddos to help them turn their head whenever they're on their stomach. Okay, that being said, this reflex is it should be fully integrated at the age of 6 months, and that means it should be completely gone, which means whenever you turn, we'll get into testing here in just a second, but whenever you turn the kid's head, their arms should not move at all, which means they've developed the appropriate motor control of their neck and their arms separate from one another. Common symptoms that you will see with this is they'll have poor balance, especially when they move their head to side with balance. They have difficulty doing cross crawl stuff, so they like to do what they call homolateral. So if they're skipping, they're going to use the same side leg, or whenever you ask them to exaggerate their walking, they're going to go same side leg. Let's see. They're going to have poor, smooth pursuit eye movements, because that has to do with very good eye-neck control, separate from the arms once again. That would be very important for reading, the ability to track your eyes. So we see that a lot with kids that have reading issues. Let's see. They could have poor handwriting, because once again, they don't have the motor development of their shoulder and hand separate from their head, so they could have very poor handwriting. They even have on here ADD and ADHD characteristics, learning problems, difficulty with multitasking, difficulty throwing a ball and catching a ball, but that all makes sense whenever you understand that this ATNR reflex has to do with the kiddo's ability to keep their head moving separate from their arm. So it's the motor ability for them to control their arm and their head and neck separate from each other. What we'll get into now is more of the testing. And treatment. All right, a couple different ways that I use to test these primitive reflexes, especially the ATNR that we're working with today, is first one you can do it standing. You have the kiddo or the adult put their feet together, and then you have them bring their hands up like this, like a zombie walk, and you have them close their eyes, and then what you're going to do is you're going to turn their head to the left, hold it there, come back, turn it again, hold it, and I like to do this 3 or 4 times. And what you'll see if this is an abnormal finding, or if this reflex is still there, is you'll see this arm start floating out this way. Or if you turn their head to the right, once again, you want to do it 2 or 3 times, tends to bring it out, and you see this arm start floating that way, you know that's a positive finding, and you know they still have that retained brainstem primitive reflex that needs to get integrated. Another way to check it is you put them on all fours, and once again, you're going to have them close their eyes, and you're going to turn their head for them. You'll do like 3 or 4 times to the left, and what you're looking for is this opposite arm to bend. Even if it bends just a smidge, that's abnormal, and that should not be there. So if I go to the right, once again, you want to do it 2 or 3 times. If you see this elbow bend, that is completely abnormal, and you do not want to have that reflex past the age of 6 months. Whenever we go into treatments, that's my favorite part. Classically, I'll have them do either bear crawls or crab crawls. You can even have them do push-ups, anything to develop the motor skills of their shoulders separate from their head and neck tend to work really, really well with this, to the point where we'll do a couple rounds of crab walks or something like that. We'll get them back up here, turn their head, or get them on their hands and knees and turn their head, and that reflex will already be gone. Now, will it come back within a half hour to an hour? Probably, but if you're consistent with those exercises and you do them multiple times throughout the day for just a few weeks, that reflex will get integrated, and that child will develop more cortical power to control those reflexes, which will help with all those different symptoms that we talked about at the beginning. Let's go over the treatments for the ATNR primitive reflex. We went over crab crawl. It's just probably my favorite one that works the best because it involves a lot of concentration. Whenever you do the crab walk, obviously you're in this position, you want your feet and hands to be relatively close together. A lot of kiddos are going to try to be like really spread out. You want to keep them close. And then the next thing is that whenever they start walking, you're going to do forwards and backwards, but they got to use their opposite foot and opposite hand at the same time. So what I like to say is you lift, 1 Mississippi, step. Lift, 1 Mississippi, step. And then you can have them go the other way. Lift, 1 Mississippi, step. Lift, 1 Mississippi, step. And that seems to work really, really well with the rehab. You can do 4 to 6 steps forward, 4 to 6 steps back, and that will get the job done, obviously multiple times a day for many weeks.